Recording in progress. Recording in progress.
We cannot see this way. Madam. Can you see the participant?
No. No. Madam, can we start now? Please.
1 more minute.
Okay.
Good evening, everyone. It gives me immense pleasure to welcome you all to this edition of Fever Quiz program. This is conducted by Fever Foundation. On behalf of Fever Foundation, I welcome once again all of you and wishing you all the best. Before we go forward, I would like to say a few things about Fever Foundation. Fever Foundation is an independent, non-commercial foundation which is supporting educational and academic activity. And it is aim of this is to address the unmet needs in the fever management. The foundation is committed to conceive, build, and sustain program and to make scientific initiatives which are aimed at providing evidence-based update to healthcare professionals. And Fever Foundation has a vision of striving towards imparting knowledge on unmet needs and providing information on research, education, and therapy updates on fever management. And some of the activities of Fever Foundation: annual fever conference, we conduct fever CMEs, we bring about books on fever management, clinico-epidemiological research, challenging case presentation competition for postgraduates, young scholar awards, patient education, paramedical education, public awareness, parent education activity. So Fever Quiz is one of the activities, and we are here today for the South Zone competition. I request Dr. Krishna to introduce our quiz master for this national level postgraduate student, the South Zone quiz. Over to you, Dr. Krishna.
Thank you, madam. A very warm welcome to both the juries joining in today. We have the quiz masters today, Dr. Professor Sukumaran sir. He has been the former professor and head department of pediatrics at PIMS Tiruvalla. He has also been the past national president of Indian Academy of Pediatrics 2011, national president IAP Respiratory Chapter 2000, and also been the national president Allergy Immunology Chapter in 2019. Dr. Sukumaran also contributed to many book chapters and is been the chief editor of many books in allergy management. Also, we have another prolific eminent speaker today, and also the quiz master joining today, Dr. T.M. Anand Kesavan sir. Welcome, sir. He's been the additional professor of pediatrics at GMC Thrissur. He's been the IAP National Vice President 2020. He's also the past National President IAP Neurology Chapter. He's also the past President and Secretary IAP Kerala Chapter, Editor-in-Chief of Indian Journal of Trauma and Emergency Pediatrics. He's been the Chief Editor of IAP TV of Pediatric Radiology, also the Frontiers in Pediatric Technology and Recent Advances in Neonatology. Welcome, sir, both of you. And for today's South Zone quiz, it's over to you to conduct the proceedings. Thank you very much. Sukumaran, sir.
Okay, good evening, everybody. Let me at the outset thank the Fever Foundation by Micronova for giving us this opportunity to conduct this quiz program here. And also I should congratulate all the participants also. Coming to the rules and regulations of this quiz program, the quiz is for postgraduate students only. The quiz consists of multiple choice questionnaire. This only multiple MCQ will be there. The option to be selected by clicking on the button on the text panel. The video display with the options will be only for the presentation purpose only. The participants are advised not to leave the platform. Once the answer is submitted, it will not be possible to revert back. There will be no negative marks. Fortunately, there is no negative marks. The winner will be the maximum first right answers. So you must answer as quick as possible. If there's a tiebreaker round will be done to decide the winners. And it is advisable to use laptops and desktops. And the time allotted for one question will be 20 seconds only. Next slide, please. It is advised to participate from a place with the good internet connectivity. If found to be any type of foul play, will be automatically disqualified. They should not use a mobile phone for getting answers from any colleagues or colleagues sitting nearby because it will take a lot of time. The time will be wasted. Fever Foundation is not responsible for any form of technical error. Participation in the quiz implies that participants accept the integrity of these rules. The participants have given incomplete, incorrect personal and contact details will be disqualified. Non-compliance with these rules results in automatic cancellation of the participation. The first and second winners from each zone will enter the national level quiz conducted at the FEPCON 23. And also, lastly, the most important is the quiz masters and judges decision will be the final. Now I request Anand to continue.
So the thing is that you have to give the right answer and also you have to do it very rapidly. The important speed, it will matters. So those who answering fastly, unlike other quiz, those who answer first, they will get the point. And you have to sit in an area where you are getting very good internet facility. Otherwise, you may get disrupted and it may create problem. Krishna, can we have some dummy questions?
Yes, sir. It's coming for people to be familiar with the platform.
Second, on behalf of this woman, sir, we congratulate the Fever Foundation for conducting a wonderful academic feast. So every year we are conducting CME, quiz for PG students, poster presentation, paper presentation, and so many academic activities. So it is, I think it is a very good academic experience for us also. And also, thank you for giving this opportunity for conducting this quiz program.
We request to start with the dummy questions, please. Can we have the dummy questions for the participant to be familiar with the platform?
Dr. Anand, please start.
Yeah,
Anand?
so you'll get a 20 seconds to answer each question, and we will have 20 questions. 20 questions in a row, and we will get a 20 seconds to answer each question. So it is a model question. Which place is known as the roof of the world? Russia, Japan, Iceland, and Tibet. Your time starts now. So now you can give the option. You can pick the answer. It's a dummy question only. Computer ji, right answer? Yeah. So it is Tibet, and it is a world famous Dalai Lama and everyone. It is Tibet only, and I think we'll see that how many of us are answered because it's a general knowledge question. Doctors are not bad in general knowledge also. I think we can expect a very good
But Anand,
answer.
I thought it was Iceland. I thought it was Iceland, not Tibet.
I
Okay.
guess 100% right it will be, sir.
Okay.
Good.
So right answer.
Can we have the graph?
See the percentage of positivity.
So who are given the first answer? Okay. So it is we got a very good number of students this time. We got, I think, very total. I think very good number of students are there. Anyway, 40% of them answer rightly, and Russia the only one be there. So and 12 each. Other Japan and other country also. So it is right answer is Tibet. So it is the demonstration question. So you can now I think you got an idea. We can see who had given the first answer, Krishna.
Do you want to see it? You want to see dummy? Dummy also you want to see, or we'll go ahead with the
And we will go ahead. We will go
two
forward.
more? Right,
Go
sir.
forward.
Okay, no problem.
Second dummy, please.
Second question, yeah. So it is a very, very simple question. Manjula madam is very kind of you. Who is the first citizen of India? The Prime Minister, the President, the Chief Justice of India, none of them.
Now your time starts now.
Yeah, time starts now.
Okay, show the correct answer.
Yeah. It's President. So President is
Just a very simple question. Just a very simple question.
Yeah, very simple question. So
So the percentage.
Should be 100% mark for 100% correct for all. We'll see the response.
That percent will be right this time.
Yeah.
Oh,
So there is also some confusion, I think. So anyway, 84 are with the right answer. That is the president, and some 3% means I think 1% each for the chief justice and none of the above. And the prime minister given 3 people are given for prime minister. So I think a majority is with the president. So that is second demo question. I will have last one. Yeah, another simple question. How many years are there in 1 millennium? 1 million, 1,000 years, 100 years, none of the above. 1 millennium. So how many years there?
So,
Time start now.
yes. End of the
So,
time, please show the
yeah.
answers. Correct answer.
Yeah, 1,000 years. So 1 millennium is equal to 1,000 years. So all a very simple question, and we see what is the answer, right answer, how many of them answered. Krishna?
Show the percentage.
Yeah, percentage. Okay, so again, 80% of them answered rightly. So I think now it is clear, rules and regulations are clear. And the only thing is that which we not demonstrate here is that speed in which we are answering. So those who answered first only will get the right answer. So not only the right answer, but the timing also very important. So you have to answer it very fastly. So that is also important. I think we can start the real quiz. We can start.
Okay, we will start now.
Yeah.
I think we will start with the first question. I wish all the best for the participants. Now we'll start. Krishna.
Yes, sir.
Okay. The first question is very simple. Fever occurs when? And the first option is core temperature is above the set point. B is prostaglandin E2 increases the set point. Thermoregulation dysfunctions. And D is cyclooxygenase is inhibited by pyrogens. Your time starts now. Okay.
Yes.
Please show the correct answer. So
Yeah.
the correct answer is prostaglandin E2 increases a set point. You know, for the thermoregulation, there's a set point is there that is in the hypothalamus, and it is regulated by prostaglandin E2. Anand, your comments?
Yeah. So it is important. The prostaglandin is E2 is very important because it will set the release from hypothalamus, and it will release some certain neurotransmitters like cyclic AMP, and then they will mediate rise the hypothalamic set point. So it is very important. In the management of fever also, when you are giving paracetamol and some other drugs, so they will inhibit the synthesis of this one. So that is very important because commonest clinical manifestation in a children, any disease is fever. So fever management and mechanism of action of paracetamol, everything is important. So the right answer is second one, prostaglandin.
Show the results. Show the results. Krishna. Show the percentage and score.
So only 28% are given exact answer. The others given some other wrong answer. So it is 28% given right answer. Can we see the who are given it fastly? First person to give the answer. So Shivani, she is a Gagdiya Medical College Warangal. So congratulations Shivani for the right answer. Others
Okay.
answered, she answered it in 6 seconds. So that is also important. Timing was very important. So she got the first answer within 6 seconds.
Okay.
So we move on to
Congratulations
this
again
question.
to Dr. P. Srivani for answering the questions in 6 seconds. We'll go to the next question. Question number 2. This is again on thermogenesis. Non-shivering thermogenesis is mediated by A is UGP1 and UGP2. B is thermogenin. C is beta-3 receptors. And the last answer D is noradrenaline. So this is regarding non-shivering thermogenesis. Your time starts now. Okay, time is over. Please show the results. Correct answer. So the correct answer is D. See, thermogenesis, there are 2 mechanisms are there. One is shivering thermogenesis and non-shivering thermogenesis. Shivering thermogenesis, there will be shivering of the muscles will be there. But non-shivering, as you know, it occurs in the brown fat in the adipose tissue and is mainly sympathetic nervous system. So the correct answer is non-adrenaline. Dr. Anand, your comments?
Yeah. So we got a third method also, that is a specific by digestion of the food also, that is specific dynamic action. So there are 3 methods of temperature protection. One is a specific dynamic action, but that daily to maintain the body temperature. That shivering mechanism is rightly mentioned. That is about skeletal muscle. We are getting rigor and stitch, that is due to skeletal muscle activity. Last one is due to adipose tissue, other muscles. Due to they will produce sympathetic activity and mainly by non-adrenaline and also adrenaline. So right answer is D, that is non-adrenaline. Now we'll see what is the response.
Percentage. Krishna? So the percentage of positive answers.
So I think only a very minority answer, that is 18%, last one, non-adrenaline. So we already explained the answer. It is a non-adrenaline, it is a mechanism of non-shivering mechanism, and the others are wrong. Now we will see that who are given the first answer. Make it fastly. Okay, very good. It is a Mohan Priya, Government Salem Medical College Salem. So I think it is a congratulations. She answered it within 4 seconds. So congratulations, Mohan Priya. Sir.
Okay, congratulations to Mohan Priya. And we will go for the next question. Next question, question number 3. Question number 3. All are recognized complications for scarlet fever is except otitis media A, B, pneumonia, C, pancreatitis, and D, arthritis. Your time starts now. Time is over. Please show the correct answer. So the correct answer is pancreatitis. As you know, scarlet fever is a bacterial infection produced by streptococci, and it is mainly characterized by high fever with cervical lymphadenopathy and there'll be a characteristic rash will be there. It is mainly confined to the trunk, and it's a maculopapular rash. And this children will have what is called a posterior line along the axilla and groin, and tonsils are enlarged, congested, and there will have a red, beefy tongue will be there. The skin rash is just like skin will be just like sandpaper. This is sandpaper's skin, and they can have a lot of complications like otitis media, pneumonia, and arthritis. Pancreatitis is not reported with scarlet fever. Dr. Anand, please comment.
All are complications of the streptococcal infection. You may get ear infection, you may get sinus infection, you may get a sinus infection, as Sir mentioned. Swollen lymph node you may get it. And also, rarely you'll get a streptococcal infection, rheumatic fever, and post-glomerular nephritis also. And pneumonia also not very uncommon. So pancreatitis totally means not at all common. So the right answer is pancreatitis. I think there's not many confusion here.
Okay. Now go for the percentage of positivity. Scarlet fever also we see a lot of children with scarlet fever during outbreaks.
Yeah.
Outbreaks we see a lot of children.
We are missing it because of so many viral fevers. I think as you mentioned, majority of the right answer. So 72% given right answer. And out of this, Priyanka from KIMS had given the fastest, but it's not mentioned. Time is not mentioned.
Okay, this time is 3 seconds. Very fast.
3 seconds. Yeah, 3 seconds. So very fast. So again, I am emphasizing you have to answer very quickly. Even though your answer is right, you'll get first plus point only if you are answering fastly. I think now everything is clear. It is going very smoothly. We'll go for next question.
Krishna Kumar. Okay. Come to question number 4. The least common cause of neonatal sepsis in India is A. Klebsiella, B. is E. coli, C. is Staph aureus, D is group B streptococci. The question is least common. You must find out the least common organism that produces sepsis in India. Your time starts now. Yes, correct answer, please. The least common cause is group B streptococcus. You know, all these 4 organisms will produce neonatal sepsis. In India, these studies have shown that previously we thought it was E. coli and E. coli. Now we see that most of the literature says that the commonest cause is again Klebsiella and not E. coli. But Staph aureus can also produce sepsis, especially following a skin infection. But group B streptococcal infection is not very commonly reported in India. But in Western literature, the commonest organism is neonatal sepsis. For sepsis is group B streptococci, especially following prolonged rupture of membranes. The commonest organism is group B streptococci in Western literature. But Indian literature, it is the least common. So the correct answer is D. Dr. Anand, your comments.
So you may get a neonatal sepsis either due to gram-negative organism like as shown here, Klebsiella, E. coli, and Acinetobacter, or it may be like a gram-positive organism like Staphylococcus aureus and a coagulase-negative Staphylococcus. Group B streptococcus are reported in India also. It is reported in some areas, but it's not common. Western countries, it is more and more reported. We are also getting some more and more reported, but for time being, it is not very common in India. It is least common at present in India.
We see more of Klebsiella. Klebsiella. No. Okay. Show the percentage of positivity.
So it is confusing for students again. They are asking for least common. That maybe I don't know whether they are read it properly. So Yeah, the answer is last one. Only 22% answered it correctly. So it is least common, not most
Oh,
common.
it's a negative question. Negative question.
Yeah.
Least common, not
Yeah.
most common. Most
Yeah.
common will be Klebsiella, and again least common will be group B streptococci. Okay, the correct answer was given by Dr. Nagamohan of Kurnool Medical College, Kurnool, and he answered it in 5 seconds.
Yeah.
5 seconds.
Congratulations.
Congratulations, Nagamohan. Congratulations. Okay, we'll go for the next question. And the next question is mulberry molars, saddle nose, saber shins, clutton joints are the classical clinical manifestations of which disease? A. Congenital rubella syndrome. B. Congenital syphilis. C. Congenital toxoplasmosis. D. Congenital cytomegaloconvolution virus disease. Your time starts now.
Relatively a simple question.
So, relatively a simple question. Very simple.
So the answer, right answer.
So it is very simple. As Ananda said, it is a simple question. Congenital syphilis is manifested by mulberry molars, saddle nose, saber shins, clutton joints, etc. You must take an X-ray of the knee to confirm the diagnosis. But congenital rubella syndrome mainly manifests with microcephaly, deafness, congenital heart disease, and cataract. And there is a triad called Greg's triad. You know what is Greg's triad? Greg's triad is a triad of 3 signs. They are present with deafness, deafness, cataract, and congenital heart disease. The commonest congenital heart disease, as you know, is PDA, followed by peripheral pulmonary artery stenosis. And this Greg's triad is first described by an ophthalmologist, by Norman Greggs from Australia. He has found out the association between cataract and congenital rubella syndrome. Congenital toxoplasmosis, they can present with either microcephaly with deafness, and CMV also, they can present with a large head, hydrocephalus, and deafness can be there. To Anand, your comments?
So, congenital syphilis is very classical features are mentioned here because it is not very common nowadays, but when we are students, it is common. And also, we get a hepatosplenomegaly, then you need different types of eye involvement. You may get a cataract, you may get interstitial keratitis, and also most important characteristic is rhinitis, snufflers. And also, they will get pseudo paralysis because of the severe epiphysis and periostitis. There is difficulty in moving the limb because of the pain. So pseudo paralysis is another feature. So I think
but we are not seeing this.
Answer,
I think students are not seeing these cases now. So the screening of all the antenatal women, we are not seeing cases of congenital syphilis now. Okay.
Anyway,
Plus,
answer. Yeah.
Correctly. Krishna Kumar, show the. Again by Dr. K. Madhu has answered it in 5 seconds. He is from Kurnool Medical College, Kurnool.
Yeah.
So congratulations, Dr. K. Madhu.
Yeah, second person from Kurnool Medical College answering. Congratulations.
Next question. Now the question 6. A preschool age child presented with a large bright red erythematous patches over both cheeks. On the next day, a symmetrical rash appears on the extensor surface of the extremities. What is the causative agent?
The
time starts now.
Timer. Right answer?
Time starts as right answer. As you say, parvovirus infection. The correct answer is parvovirus infection. We can just see the slap cheek appearance in this child. Rubella, you know, is a mild disease, person with 3 days fever, and there is an lymphadenopathy will be there. In measles, there will be the classical features of measles will be there. They will present with a fever of 5 days duration, with complex spots will be there, and rash starts on the face and disappears in this order, and they develop complications. So parvovirus infection is the answer here. Now comments from Anand.
Yeah, it is a slab appearance, a classical skin manifestation as shown in the figure. Also called fifth disease because it's in that order, fifth disease. And also erythema infectious is another name. So the importance of rash is that once the rash appeared, the fever suddenly falls. So it is very good clue for the clinician also. So right answer is parvovirus B19 infection.
And these children may develop complications like aplastic anemia is commonly seen. They can have bone marrow suppression will be there. Okay. Show the percentage of positivity. Okay. It is 79.49%. So it was also a simple question. Who has done it correctly? Fastest person. I think all people are from Karnool. Dr. Mahalakshmi from Karnool Medical College, Karnool. Congratulations for Mahalakshmi.
3 seconds. She asked in 3 seconds.
3 seconds. Next question.
On to the next question.
The next question is regarding camptodactyly is seen as a complication in FMF, Blow syndrome, CAPS, and Majid syndrome. Your time starts now. So it's a complicated one. Okay, show the correct answer. It is Blow syndrome. These are very rare syndromes. These are auto-inflammatory syndromes. FMF stands for familial Mediterranean fever. That is the commonest periodic fevers that we see. And these children will present with recurrent episodes of fever, and they can have abdominal pain and recurrent peritonitis may be there. Blow syndrome is again an auto-inflammatory disease. They will have mainly 3 main features will be there. They will have granuloma of the iris, dermatitis, and polyarthritis may be there. And camptodactyly is one of the physical findings. Camptodactyly means there is a flexion contraction of the fingers will be there. The flexion contraction of the fingers is called camptodactyly. It will be there in Blow syndrome. CAPS means usually this CAPS we take it as community acquired pneumonia, but it is not. Here it is not community acquired pneumonia. It is what is it called? It is called cryopyrin mediated associated periodic syndrome. It's a cryopyrin associated periodic syndrome, and this is mainly characterized by skin lesions, and they will have associated arthritis may be there. And the correct answer is given by 43.59%. So the person who was given the correct answer.
Yeah. When it is a tough
Anand,
question,
your comments?
43%. Yeah. When it is a tough question, 43% is given a good answer because again from the same medical college, it is 3 seconds. Nagamohan.
Usually the PGs will answer tough questions correctly, as always.
Simple
They will
question.
study rare things first. Congratulations, Nagamohan from Kannur Medical College. Next question. Now the question number 8. The false statement about CTAP test is A. Point of care skin test. B. Helps to detect TB disease. C. Unaffected by BCG vaccination and uses a cutoff value of 5 millimeter. What is the correct answer? Your time starts now. So it's a false statement.
Negative question again.
The time starts now. Time is over. Show the correct answer. Correct answer is B. It is a false statement. It must be a false statement. CTAP test is always called cutaneous TB test, and it was started in Copenhagen in Denmark. And this test is mainly for picking up TB, latent TB, and not tuberculosis infection. You can have a tuberculosis infection and tuberculosis disease and latent TB. Latent TB is same as tuberculosis infection. It is not a disease. And CTAP test is used to pick up latent tuberculosis. And CTAP is a specific test, and it's almost just like a Mandor test. It's just like a Mandor test. You just inject the antigen. The two antigens that is commonly used is called ESAT6 and CP and CFP10. This antigen is specific for mycobacterium tuberculosis. It is not seen in BCG vaccination. It is very specific. It is seen in mycobacterium tuberculosis. After injecting intracutaneously, you read the induration after 48 hours. If the induration is more than 5 millimeters, it is taken as a positive CTAP test. So the answer is B. Anand, comments?
Our National Tuberculosis Elimination Program, NTP, already banned the Mandor test because of non-uniformity of the test. And so now we are planning to bring, central government is planning to bring indigenous seed skin test. Unlike in Mandor, it is not affected by BCG vaccination, and the reading is not 10 millimeter, as shown here, it is 5 millimeter. As sir already mentioned, it is not showing the disease, it is for latent and infection, not disease. So we got 50%
So I think Mandor
right.
test will be replaced by CTB test,
Yeah,
even according to the national guidelines.
and it is not available in government sector now.
So the correct answer is given by Dr. Jyoti from Kim's Hubli. So she took 6 seconds. Congratulations, Dr. Jyoti. We will go to the next question. Next question, please. Next question is the duration of nevirapine prophylaxis if mother ART less than 24 weeks during antenatal period. The answer A is 4 weeks, B is 12 weeks, C is 16 weeks, and answer D is 18 weeks. Your time starts now. So the correct answer
Right answer?
is 12 weeks. Comments from Anand.
Yeah, we have to, if mother taken, it's less than 24 weeks, we have to do 3 months of nevirapine prophylaxis so that we can completely miss to an extent we can treat the baby also. So 12 weeks is the treatment option. 18 weeks, 16 weeks is not the right answer. So 12 weeks you have to give the nevirapine.
So nevirapine should be given for a minimum of 12 weeks. Show the percentage of positivity. How many people has done it correctly?
Percentage, sir?
What is your guess, sir? How many will be getting it right, sir?
I think because it is in numbers will be difficult to answer. Number will be difficult. I think 50-50.
Yeah, I
Yeah.
cannot remember
And close
number.
numbers are there. Very
Ah,
close
sir.
numbers are there. Very close
The only
numbers.
close that
But
is
this is a very
16 and
important question
18
for all
weeks.
postgraduate students. How
Ah,
to
sir.
prevent the
Yeah.
mother-child transmission of
Yeah.
HIV.
It's a very common question for their examination. So they are very thorough about it.
So the correct answer is given by
HIV prevention of mother to
75%.
child
75%
transmission.
is given the correct answer.
Yeah, very good number of students. Yeah.
So again, once again, Dr. Nagamohan from Karnool Medical College has given the correct answer. That is in 2 seconds because it is a very common topic. They have to study very well. Mother to child transmission of
Yes.
HIV prevention.
Answered
Okay.
2 seconds. Very common.
Next
And this
question.
time, theoretically, they asked the same question. Mother to child prevention in Kerala.
10th question. And the 10th question is terminal complement deficiencies are at higher risk of infections due to which organism? A. Pneumococci, B. E. coli, C. Salmonella typhi, D. Neisseria. What is the correct answer? Your time starts now. Time is over. Show the correct answer. So the correct answer is Neisseria meningitidis. It is seen that there's a high incidence of Neisseria meningitis with terminal complement deficiencies. They are at high risk of developing infections with Neisseria. Comments from Anand, and again, so it is a preventable disease.
In case of pneumococci, there are so many predisposing factors like asplenia, cupriform plate damage, or you may get ear infection. Similarly, Neisseria meningitis, when you are getting a recurrent meningococcal or gonococcal infection, recurrent meningitis, you have to think about immune deficiency or common immune deficiency. So in case of Neisseria meningitis, you have to look for the common immune deficiency. Usually it is a terminal complement is affected. So this is, I think, comparatively a simple answer, simple question. I think majority may be answered. The percentage, please.
Please show the percentage. Okay, I think all the PG students should study about immunodeficiency, congenital and acute immunodeficiency syndromes. They study. I think the answer was D. So the correct answer is given by 63%. 63%.
Yeah.
Who is the person who did the answer at the least time? Again, it is Dr. Neeraja from Karnool Medical College. In 3 seconds. Congratulations, Dr. Neeraja. Then we will go for the next question. Now I request you to take over. For the next 10 questions, my friend
You
Anand
can,
will take over.
you can continue. So majority of answers from Karnool Medical College.
I think there are a lot of candidates from Karnool.
Yeah.
Lot of candidates are from Karnool. Karnool is from Andhra or Telangana? Madam? Karnool is Andhra or Telangana? I think it is Andhra.
So
Okay.
next question.
Next question. Question number 11. Anand.
Yeah, it's another common scenario. Most common cause of hand, foot, and mouth disease is Coxsackie A6, Coxsackie A16, Coxsackie B12, and enterovirus 71, which is the commonest cause for hand, foot, mouth disease. I think now it is a season for the Coxsackie virus also.
Yes. Correct answer. Show the correct answer. So the correct answer is Coxsackie X16. Hand foot mouth disease has again come back now. Now we are seeing last week also, this week also, we are seeing a lot of children with hand foot mouth disease. Actually, you must change the name to hand foot mouth buttocks, hand foot mouth and buttocks disease, because the lesions are mainly seen in the oral cavity. They will present with herpangina. Then they will have vesicles in the hand, mainly in the elbow, knee, sole of the foot, and also in the palm. Seen also in the buttocks also. Usually this condition subsides within a period of time. No active interventions are required. We treat only with symptomatic drugs. Antivirals are not very much indicated. Even enterovirus 71 also can produce severe hand, foot, mouth disease. Even though it is a very simple disease, rarely it can present some of the complications, like they can present with ADEM, severe disseminated encephalomyelitis, and they can present with the myocarditis. They can present with respiratory distress syndrome. So rare complications can occur. Rarely they can present with the severe disease. One thing I want to emphasize is the antivirals are not required for the treatment of hand, foot, mouth disease. So the correct answer is B.
Yeah, very common disease with less complication, but rarely enterovirus 71 will produce encephalitis like picture or carditis. And also another common manifestation we are seeing oncolysis, that is a loss of nail. Rarely we are seeing loss of nail.
Yeah. But it is usually later. Loss of nail after second month, third month, they came later. Okay. So the name of the person was done correctly. Again, Dr. Jyoti from Kim's Hubli.
Yeah.
Second time she is giving the correct answer.
Yeah.
Congratulations, Dr. Jyoti. Next answer.
Yeah. Next question. Are you ready? Next question. We have almost finished half the way. So, what is the minimum internal diameter of giant coronary artery aneurysm in children who present with Kawasaki disease that pose the highest risk of rupture, thrombosis, and myocardial infarction? 8 millimeter, 10 millimeter, 12 millimeter, 50 millimeter. So, which is the right answer?
Your time starts now. So it is very difficult to say 8, 10, 12, 15. Only mild difference is there. Okay, show the correct answer. So the correct answer is A, 8 millimeter. 8 millimeter. See, coronary artery involvement is more commonly seen in the second week of Kawasaki's disease. We are seeing a lot of children with Kawasaki disease, especially children less than 5 years, presenting with fever of more than 5 days duration, with 3 out of 5 criteria. Then you can diagnose Kawasaki's disease. They present with fever, truncal rash, then erythema of the palm twin soles, crackling of the lips, angioedema of the lower limbs. Rarely they can present with involvement of the gallbladder and coronary arterial aneurysm. We give IV, the treatment of choice is IVAGG, which can prevent coronary artery aneurysm. But In the clinical criteria, giant coronary artery aneurysm is not given as a criteria for diagnosis of Kawasaki disease. I think it should be included as a criteria for diagnosis of Kawasaki's disease. And aneurysm is mainly seen in the second week of coronary, second week of Kawasaki, and that can be treated with IgG. And we have got resistant children with resistant Kawasaki also. They can be treated with prednisolone or other agents. Anand?
Again, we are seeing more cases. When it is classical cases, it may not be a problem. But when you are seeing atypical Kawasaki disease, one may get confused. So the most important complication, or the only one serious complication is coronary artery involvement. So any suspected cases, we have to do echocardiogram and we have to measure the size of the coronary arteries, because you might not get clinically, there won't be any evidence of coronary artery involvement. So in all suspected cases, you go for echocardiogram and coronary artery measurement and you start the treatment.
See, the problem is not Kawasaki. The main problem is MIS-C now, multi-system inflammatory disease. We can also present with just like Kawasaki, and there can be coronary involvement also in MIS-C. So the correct answer is given by 17%, 17%.
It's a comparatively common question. I think only 17% answer.
But thing is that even the pediatrician will not know about the size of the coronary.
Size of that.
If the size of the coronary is more than 3 millimeters, it is taken as coronary dilatation. We don't know. We send the case for a cardiology opinion. They will give the results. So the correct answer is given by Dr. Mahalakshmi, again from Kurnool. Congratulations, Mahalakshmi. Next question.
So, a sick-looking child with a fever and a severe dysphagia is brought to the emergency. Nasopharyngeal swab is taken and a specialist staining is done. Identify the organism and specialist stain used. So, I think here very characteristic picture. You have to see the picture and it is very clear. Bacillus anthracis and a ponder stain. Corynebacterium diphtheria and a ponder stain. Bacillus anthracis and a PAS. Corynebacteria diphtheria and Albert stain. So your time starts now.
Okay, time is over. So the correct answer.
Right answer. There's no confusion regarding Bacillus anthracis. Bacillus anthracis is not a cause. So Corynebacteria, the stain is Albert stain. You can see the drumstick appearance and with the bacilli at the end. So it's a very, very characteristic feature of Corynebacterium staining. So you can be very clear. Sir, more explanation, sir?
So it's of a Chinese letter pattern. It's called a Chinese letter. The colonies are called Chinese letter pattern of the colonies in diphtheria. I think people should read more about diphtheria. Show the percentage of correct answer.
Again, there is an emerging of the diphtheria. That is why we again now started to give, instead of TT, we are giving DPT or DAP. So again, you have to give the booster dose.
You must give TDAP. Children about 7 years, we should give TDAP. Even Kerala also, we had some outbreaks of diphtheria from nearby district to the shore. Again, from Malappuram district and Calicut, we have children with diphtheria and they have presented with complications like myocarditis and a few has died. So it is very important to give vaccination against diphtheria and pick up diphtheria also. So all children with sore throat and a patch over the tonsils, you must send the swab, throat swab for culture and also microscopy for diphtheria.
Very good, sir.
Oh, very good, very good. 100%.
The first time I think 100% answered.
Okay, okay.
So now the question of speed.
Oh.
Yeah. Krishnagala.
What is the time taken by Krishnagala?
4 seconds.
4 seconds. Again, congratulations, Dr. Krishnagala. We will go to the next case.
Earliest complication of diphtheria. Again, I think related to this one. Myocarditis, polyneuropathy, bilateral palsy. So again, I think it is
Time starts
comparatively
now.
simple. So earliest complication.
Time starts now. So the correct answer. So the correct answer is myocarditis. The question is earliest complications of diphtheria. I think when we were students some 40 years back or 50 years back, we had a diphtheria ward. Diphtheria ward was there in the Medical College Kottayam. We were seeing a lot of children with diphtheria. Our professors usually say, if a child with diphtheria omit, they are presenting with vomiting, definitely you must suspect myocarditis. The earliest symptom may be vomiting. And so we must follow up these children who are coming with vomiting. And myocarditis is a very, very common complication. And now it is seen that the myocarditis is mediated through carnitine. There is some role for carnitine also for treatment of diphthetic myocarditis. Polyneuropathy, palatal palsy is very common, very early. And palatal palsy can be due to two causes, because of the inflammation of the tonsils and can produce nasal regurgitation, and also palatal palsy. True palatal palsy due to vaginal involvement is also commonly seen with diphtheria. Regarding ocular palsy, the commonest problem is loss of accommodation. The earliest stage may be loss of accommodation. And all these cases of diphtheria, the treatment of choice should be ADS, not immunoglobulin. Is diphtheria is ADS, antidiphthetic globulin. Now coming to the correct answer.
Yeah, polyneuropathy is a late manifestation, and the cause of death also myocarditis. So you have to detect it very early and you have to give supporting. The correct answer 57%.
Okay.
Now only 40% give a right answer.
Oh, right answer given only by 40%.
40%.
Again,
KIMS.
Dr.
UP.
Jyoti from KIMS. I think this is the fourth correct answer by Jyoti. Time taken is only 3 seconds. Congratulations, Dr. Jyoti, once again. We'll go for the next question.
Hex pneumonia is due to cytomegalovirus, measles, malaria, and pneumocystis carrying. Time starts now.
Okay, show the correct answer. Again, measles. Hex pneumonia is one of the complications of measles. Hex pneumonia stands for the interstitial pneumonia produced by a virus. It's a viral pneumonia. So it may be seen in the early phase of illness. And these children with measles, they can have secondary bacterial pneumonia. The commonest organism may be Staphylococcus, especially those children with measles and malnutrition. They can have bronchopneumonia due to Staphylococcus also. So Hex pneumonia is seen in children with measles. CMV rarely produce pneumonia and also malaria. In children with HIV or children with immunodeficiency, there's a high chance of pneumocystis carinii pneumonia. So the correct answer is measles.
Okay,
Hex pneumonia is seen in measles.
Yeah.
Anath.
Yeah, this was I think okay.
Simple question.
Yeah, simple question. Other
So the
malaria
percentage.
we are not seeing very commonly here, so pneumonia also not very common. The answer is very simple.
Okay, show the correct answer. Percentage of correct answer.
Welcome, Anand Vasu sir. Welcome.
Rashna Das ma'am is also there, sir, in the
Ah.
panel. So Dr.
Rashna
Rashna Das ma'am and Dr. Anand Vasudev
Yeah.
are there, so in the panel.
Yashna madam has done a wonderful job. So we got 57% right answer, and still 27 and 15 also gone for some other answer. The comparatively, this comparatively, though the name may be confusing, X pneumonia, but it is there in all standard textbook.
Oh, even the old Nelson also it is there.
It's
The
there.
old Nelson we have studied. It is there.
Yeah.
It is there. Very old one. Okay.
Okay.
Show the name of the person.
Who is the lucky person? Mahalakshmi. Okay.
Again, Mahalakshmi from Karnool.
Mahalakshmi, what is so many?
Mahalakshmi has done very well.
Yeah.
Congratulations, Dr. Mahalakshmi.
Yeah.
Next question.
So question number 16. A 26-year-old pregnant lady is diagnosed with toxoplasmosis. What is the best information regarding risk of transmission of congenital toxoplasmosis? Best information. Risk of transmission is maximum in third trimester. Organism transmitted through direct contact during delivery. Transmission more in second trimester, person to person. So you want the best information. So your time starts now. So right answer.
So the correct answer is risk of transmission is maximum in the third trimester. See, in most of the intrauterine infections, the maximum transmission occurs in the first trimester. We are mainly concerned with first trimester. For example, rubella, congenital rubella, and almost all other intrauterine infections, the maximum transmission occurs in the first trimester, except for toxoplasmosis, in which the maximum transmission occurs in the last trimester. Last trimester is very important, and also it is very important to pick up because it's a treatable condition.
Yeah, unlike other rubella, cytomegalovirus, I think it is we can regularly treat it being a parasite. So the third trimester, unlike other diseases, it's maximum incidence in third trimester. We'll go for the percentage.
And these babies can present with either hydrocephalus, microcephaly. They can have calcification in the brain. CT shows calcification.
The percentage.
And contact with cat is very important. Contact with cats. Avoid contact with cats.
Very rarely we are seeing. We are not seeing. Not.
We are
Yes, we are
rarely seeing.
Yeah.
But also we are seeing no newborns also because we have left newborns. Neonatology has become a separate specialty now. No, adult pediatricians are not seeing newborn. Okay, correct answer.
Yeah.
No, the percentage.
So quite
Okay.
good number of them given.
Good number. 55.5% has given the correct answer.
Yeah.
So the name of the person. Again, Mahalakshmi from Karnool. He has done the correct answer in 4 seconds.
Yeah.
Okay. Right. Next question.
A 2-year-old boy is brought with a skin hypopigmentation. He's a diagnosed case of Cheddar-Higashi syndrome. He has light skin, photosensitivity, neuropathy, and a prolonged bleeding time with a normal platelet count. Which one of the treatment improves the clinical outcome of some children in this stable phase? So all the different vitamins, vitamin B12, vitamin B1, vitamin C, vitamin E. So your time starts now.
Okay, show the correct answer. Again, the answer is also C. The
Yeah.
correct answer is vitamin C. The code is C also. As you know, celiac is not a very common disease, but we have seen cases of celiac because it is very easy to pick up clinically celiac syndrome. A child who is presented with recurrent infections, recurrent abscess in the liver, spleen, etc. If you look at the child in general examination, if there is an oculocutaneous albinism, partial albinism is there. Oculocutaneous albinism with recurrent infections, your diagnosis of choice should be celiac, and you can make a diagnosis by a simple test. You look for a peripheral smear. Peripheral smear shows granules, large granules in all the neutrophils and eosinophils. If granules are there, you can make a diagnosis of celiac, and the treatment of choice should be why you can supplement vitamin C for these children. They may improve.
Yeah. I think nothing much sir told.
Okay.
Yeah, vitamin C is the treatment in some patients.
So it's a
Personally,
clinical diagnosis also,
yeah.
confirmed by a peripheral smear.
Comparatively very good response.
Very good response,
Yeah.
51.28%.
Yeah. They will answer difficult question. Not difficult, but comparatively rare question.
I think PGs will answer rare questions very quickly. Again, congratulations to Mahalakshmi. He is marching forward. In 4 seconds, he has answered. Again, congratulations to Mahalakshmi. Next question.
So question number 18. Following are the characteristics of viral fever except it affects multiple systems of the body. Child looks sick and often toxic during the interfebrile period. Fever high at onset. Similar illness in the family. So you want a viral fever except if you want. So your time starts now.
Okay, show the correct answer.
Yeah.
Okay, the correct answer is child looks sick and often toxic during interfebrile period. So we are seeing a lot of children with the viral fevers, especially during this season. There are outbreaks of all viral fevers, influenza-like illness, H1N1, all these fevers are there. Now, how do you clinically suspect a viral fever? If a child is presenting with a high fever, they present especially the high fever, the onset, and if the child is not sick looking in the febrile period, the child is febrile, if the child is not not looking sick, then most probably is a viral fever. In children with bacterial infections like pneumonia, they'll be sick even during even when the child is febrile. And also it is very important to see that multiple systems are commonly affected in a viral fever. A child presented with a congenital congestion, child presented with rhinitis, oral cavity is congested, respiratory symptoms like cough, and if the child is having a diarrhea. So multiple systems, 3 or 4 systems are affected. Most probably is a viral infection. Whereas in a bacterial infection, a child will present with a severe ear pain, maybe ASOM, or a child can present with a sore throat alone. It may be a follicular tonsillitis. If a single system is affected, single organ is affected, most probably it is a bacterial infection. And to these children with a viral infection, they will not be sick. They will be playing well in between the episodes of fever. Anand.
Yeah. So it is very important to differentiate bacterial from viral infection. Our students, they answered very, very well. 95% right answer. So we should decide whether it is bacterial, viral, so that whether there's any indication for antibiotics. Also, you'll get different types of skin. Sir mentioned almost all clinical features. Also, you'll get different types of skin rash. That is also very important in a viral infection.
Okay, congratulations to Nagamohan. Next question number 19.
So, an 18-month-old child with atopic dermatitis presented with high fever, irritability, discomfort, and these lesions. The lesions shown here. What is the most likely diagnosis? Eczema herpeticum, that is Kaposi vericilliform eruption, pemphigus herpetiformis, impetigo, dermatitis herpetiformis. So you see the picture and your time starts now. Time.
Okay, so the correct answer. So the correct answer is eczema herpeticum, or it is always called Kaposi's vericilliform eruptions. See, atopic dermatitis is a very common disease that we see, common allergic problem, common allergic skin problem. Nearly with a prevalence of 10%, 10% of our children may have atopic dermatitis, and rarely they can present with high fever, irritability, and discomfort. Then you must suspect eczema herpeticum. There's a classical picture of the eczema herpeticum. And pemphigus, this is not the classical picture. Pemphigus, they usually present with bullous eruptions. Impetigo also is easy to diagnose. Dermatitis herpetiformis also can present with bullous eruption, and they may be associated with multiple disease. So the correct answer is eczema herpeticum.
Yeah, comparatively easy to diagnose. Once we see one case, it is very easy to diagnose. And somehow we are not seeing very commonly.
No, this is not very common. It is only a theoretical complications.
So percentage, please.
But atopic dermatitis is very, very common.
Yeah, very common.
Structural dermatitis starting with involvement of the face, starting from second month of life. We are seeing a lot of children, especially those children, those parents working in US, UK, Gulf countries. There's a high incidence of atopic dermatitis. All the allergic disorders, including atopic dermatitis, we are seeing increasing amount is seen.
So we got a very good number of right answer. That is 57% right answer. And now we see who is the first to answer. I think first Drishya from Tumakuru, I think her first right answer. They answered within 2 seconds. Congratulations, Drishya.
Okay. The last question. 20.
Yeah, our last question. We are taking 1.5 hours, madam. It's some time lag. The last question. Again, Warthin Fingal giant cells are pathogenic for mumps, measles, rabies, and molluscum.
Time starts now.
Yeah, time starts now.
So the correct answer. The correct answer is measles. Warthin Fingal giant cell, they are multinucleated giant cells. Actually, they are seen in the histopathological lesion of Koplik spot. If you take a biopsy of the Koplik spot, it shows Warthin Fingal giant cell, which is diagnostic of measles. And usually,
we are given many questions regarding measles, H pneumonia, then Warthin Fingal giant cells.
But because of the immunization, we are seeing less children with measles now, because of the high coverage of MMR vaccine So we are seeing less number of children with measles. And also it is very important to pick up and prevent measles virus infection in our children.
The big epidemic of measles in Kerala, Malappuram, Kozhikode and Kasaragod district. So many cases of measles are there. All over India also, Mumbai and North India also reported so many cases of measles.
And also we see a lot of children with measles-like illness also. Measles-like illness also. Following vaccination also they can present with a low-grade fever on the 7th or 8th day with a small rash. It is called a measles-like illness. For the diagnosis of rubella, we will have what is called an Hoshime spots be there in rubella. In rubella, the inandam is called Hoshime spot. This is it. Okay, show the
Percentage. So I think we got a very good response. 74% given the right answer, which is the last question. So first question, last question are simple. So we'll see who answered it fastly.
Yes, sir. Okay.
Oh, again, Prashant from Madurai.
Madurai.
Okay.
Okay, and that is the last question.
First round is over
Yes, sir.
for the winners.
So they'll take some time, another few seconds.
Yeah.
Maybe Rachna Das ma'am and our experts are there if they want to say something before our scorer gives the results. So, ma'am.
We have to congratulate the Department of Pediatrics, Cornwall Medical College, because they sent so many students, and all of them performed a maximum number of students from Cornwall
And
Medical
maximum right answer fastest.
Yeah.
Right, sir?
Yeah.
It appears they must have swept the South Zone. It appears to me. I don't know. Scorer has to say.
Yeah. Last year, my partner was Rashna madam. This time she, I don't know what is reason. Last time we conducted together, madam. Last year.
Yes, sir. Sir, you went to East Zone that time or South Zone?
No. That was the final.
Sir, it was final, sir.
Oh, yeah. Time is there. Okay, no problem.
Still time is there for finals.
Conducted together. It was very nice. Questions were a little tricky, but I think that particular medical college, the students are very well taught.
So, yeah.
Yeah. For that Kawasaki disease diagnosis, no, nowadays they are saying that if they are going, some of the people include echocardiography as the first line investigation. And there are some discussions going on about including it as one of the diagnostic, criteria, because if you can get those findings in the echo, it makes your life easy.
But the same problem is with the rheumatic fever also. Nobody diagnosed rheumatic fever within that margin item. Everybody looks for the echocardiogram. So American Heart Society already include the echocardiogram as a diagnostic criteria. But WHO, because of the problem in developing countries, they are not included the echo. But we are diagnosing rheumatic fever with the help of echo only.
Yes. And in fact, in the standard treatment guidelines, I was the lead author for that. We have included the echo as a diagnostic criteria, and that particular findings in echo also were nicely described in the guidelines.
Yeah. So, we are making questions single subject fever. So, for zonal quiz means making so much a question based on fever, it may be very difficult. So, next time we have to find more and more new questions.
I think we have to include other diseases like that person is fever, especially collagen muscular disease, malignancy.
Yeah, we can include some more broad spectrum. That may be, madam, Miss rheumatic or Miss collagen muscular disease, immunology. Listen, you can do.
And also, it's very important that we had a lot of questions on vaccine preventable disease. For a general pediatrician, it is more important. VPDs and the prevention.
Yesterday, we had questions on vaccines.
Yeah.
have only 2-3 pitches. We can include some extra pitches next time, something like that. If we've got some
Yes.
most mind, something like that. I might say next time we'll select more questions. I think comparatively yesterday we got only 6 participants. Today we got a very good
No,
number of.
sir, towards the end, it became more.
Yeah.
It became, I think, 67 or 74.
Yeah.
176, I think, today. No,
Madam, the main
right,
problem with
today?
main problem with the PGs are they come late. Usually, in a 4-hour classes, if they come late, they will be out. You do not allow the PGs to enter the class. If they come late, morning class starts at 8 o'clock. If they are not in our in front of our classroom at 8 o'clock, they'll be out. I think we must be very strict about timing for PGs.
Now the problem is that the first year not admitted, last year gone after examination. So number of pages less. Yeah.
Yes.
Results.
So we are eagerly waiting for the result.
Yeah. And also parallelly, I think Vikram is landing on moon also. That also is happening parallel.
Yeah.
Hope that there
Chandrayaan.
won't be need for tiebreaker rounds.
I don't think so, sir. This time, that is my let the scorer say.
Yeah.
I think it will be no tiebreaker.
Till 15, 16 question, it was that scenario. Last 3 question, it became more clearer actually. Last 2-3
Yeah.
questions.
Yeah. That dummy question is very useful, madam. Madam, I think, madam, in dummy question itself, you can mention the time, madam. Because importance of time. Because here time is more important. Because 100% is answering and only one getting mark. So in dummy question itself, we can give the importance of time. We are saying it repeatedly, but after 3-4
put in
questions,
the guides, it is there, sir. That it is the right answer fastest.
yeah, but they don't know practically what's the importance of that one. Krishna, any confusion?
No.
Because
No,
Krishna,
we can include one more slide saying that 20 question, 20 minutes. Again, one more fastest.
yeah,
Right answer will win. Like that.
When we
sir.
declare the
3
results?
points.
Krishna,
Yeah.
is it time to declare?
Yes.
Yeah. I think, Yash, can you show us the scorer? Yeah.
Oh,
I think that put.
so
Yeah.
there's no.
as he already predicted,
Both
there is no confusion.
Both from the same colleges.
I think there is no confusion now.
Yeah.
There is no extra time.
So,
Can you show us from their college institution, first and second?
yeah,
I think
So you can
only-
congratulate all of them because
Kannur.
everybody played well.
yeah,
Both from
Karnool, there are a lot of students from Karnool. Sanand said
Yeah.
we should
Yeah.
congratulate the HOD from Karnool. I don't know who is the HOD now. Karnool
Yeah.
for the outstanding performance of the students. They
yeah,
are doing very well. So
Exactly.
congratulations, Dr. Maharashmi, for being the first, and Dr. Nagamohan for being second.
yeah.
Hearty congratulations.
Both of them are eligible to present the South Zone. So our next zone meeting will be, last round will be in November in Bangalore. So, madam, we have to visit, your person should visit to Cornell Medical College to
Yes, sir.
congratulate. Yeah,
100%. So,
yeah,
so congratulations, Dr. Mahalakshmi and Dr. Nagmohan. Our Fever Foundation team will meet you personally and give you all the details about the finals and how it is played.
Yeah.
So definitely tomorrow, I think itself they will meet you and take it forward. Right.
Yeah.
So, but I congratulate all the players. So only these were very fast. Their fingers were very fast. All might have answered correctly, but these people were very fast in answering. Right, sir?
yeah.
Yeah. So before we close, Dr. Sukumaran sir, Anand Keshman sir, and Madam, final words before we close this meeting.
looking forward for tomorrow.
So we'll meet the same time, same place tomorrow.
Thank you once again, madam, for
Thank
the
you, madam.
excellent present, excellent arrangements, and also
Yeah.
the Fever Society for organizing this quiz program, Fever Foundation. Thank you very much.
Better. Thank you.
Yeah.
So congratulations to all.
Yeah,
That's
only I
it.
think the music is missing from the. We
Yeah,
had
yeah.
it on KBC, but this time I hear no music.
So,
Right, right.
okay.
Please send
So yeah,
that
congrats, and then
posting.
we can stop live streaming now.
Okay.
Yeah.
Thank you very much. Okay.